Good day, ma'am. I'm Atea May Dilusar, student nurse for today from MCNP. So today, I'm going to examine your cranial nerve to provide insightful and vital information about the patient nervous system. Is that okay to you, ma'am?
Yeah.
But before we start, may I ask your name first?
Laika lang dito.
How about your age?
18.
Okay, ma'am, but before that, I'm going to perform the proper hand hygiene. I'm going to put on a gloves. And prepare work area and then assemble equipment and materials. And I'm going to proceed to olfactory nerve. And I'm going to check the nasal passages if it is clear. Ma'am, can you please remove your face mask? I'm going to check your... I'm going to proceed. Ma'am, can you please close your eyes? Then, takpan niyo po yung nostril niyo na isa. Then, hinga po kayo ng malalim. Amuyin niyo po itong ipapaamoy ko.
Vinegar.
Yes, tama po yung sinabi niyo. And we're going to the next. Ma'am, can you please close your eyes again? And sa kabila naman po. Amoy niyo po itong ipapaamoy ko at sabihin niyo po kung ano yung naamoy niyo.
Coffee.
Yes. Next, we're going to the optical nerve. Next, I'm going to proceed into the optic nerve. And I'm going to use the Snellen chart 6 meters away from the patient. I'm going to test each eye separately. Ma'am, can you please read this letter?
E, F, P, T, O, G, L, P, E, D.
Okay. So the visual acuity of my patient is 20 by 50. So natapos siya hanggang sa 7th line. Next, we'll proceed to your visual field. So, ma'am, can you please cover your one eye? And then, look at my opposite eye. And then, sabihin mo sa akin yung nakikita mo.
2, 3, 4, 2.
Again. Ma'am, can you please cover your left part of your eye?
2, 3, 2, 4.
Okay, as you can see, the visual field of my patient has a normal visual field. Next, I'm going to proceed into your oculomotor nerve, and I'm going to use pen light to your check your light reflex. Other one. Ito po muna ha! Next, I'm going to proceed into the trigeminal nerve. Ma'am, can you please clench your teeth? And I'm going, then feel the masseters and estimate their book. Next, I'm going to ask the patient to open his jaw against the resistance of my hand. Ma'am, can you please open your jaw? Next, I'm going to proceed into the two reflexes. And the first one is I'm going to check your corneal reflex using a damp cotton wool. Ma'am, can you please remove your eyeglass? The next one is I'm going to check is her jaw jerk or reflex. I'm going to ask the patient to let his mouth hanging and loosely open, and I'm going to place my forefinger in the midline between lower lip. And I'm going to percuss finger with the hammer of the patient. Next, I'm going to test your facial nerve, ma'am. I'm going to use a cotton buds on the patient tongue dipped in sugar, salt, vinegar, with rinsing his mouth out between each test. So I'm going to Ma'am, anong lasa po?
Sugar.
I'm going to try another one.
Okay.
Ma'am, anong lasa po? Okay? Tama po yung mga sinabi mo, ma'am. Got all the correct. Next, I'm going to ask the patient to wrinkle the forehead or look up. Ma'am, can you please wrinkle your forehead? And next, I'm going to ask the patient to wrinkle the forehead or look up. Ma'am, can you please wrinkle your forehead and look up? Ma'am, can you please bare your teeth? Ma'am, can you please screw your eyes and keep them closed? Okay. Next, last but not the least, I'm going to ask the patient to blow out his cheeks. Can you please blow out your cheeks, ma'am? Okay. So as you can see, my patient got it all correct. Next, I'm going to proceed to test her vestibulocochlear nerve. I'm going to whispered voice test. So, bubulong po ako sa aking pasyente. Ma'am, ano yung narinig niyo sa sinabi ko?
Beautiful.
Okay, you got it. So next, I'm going to glossopharyngeal nerve and X vagus nerve. I'm going to use the more reliable water swallow test. Ma'am, can you please drink this water? Again, ma'am. Next, I'm going to ask the patient to say and look at the movement of the palate and uvula. Ma'am, can you please say
Ah.
Okay. Next, I'm going to ask the patient to puff out his cheeks with the lips tightly closed. Ma'am, can you please puff out your cheeks with the lips tightly closed? Okay, ma'am. So I'm going to test your accessory nerve. I'm going to observe your shoulder. Next, I'm going to ask the patient to shrug shoulder against resistance. Okay, please shrug your shoulder. Next, I'm going to ask the patient to turn her head. Ma'am, can you please turn your head? The other side, ma'am. Next, I'm going to test the hypoglossal nerve of my patient. I'm going to observe for wasting, fasciculation, or involuntary movement. Next, I'm going to protrude tongue and look for any deviation or involuntary movement. Ma'am, can you please side to move your tongue to side to side? Okay? Ma'am, I'm going to press your tongue against your cheek while you apply pressure from the outside. Other side, ma'am. I'm going to assess its speech and swallowing. Ma'am, throughout the assessment, are you comfortable?
Okay naman po.
Are you still okay?
Okay po.
So, ma'am, I'm done to examine your cranial nerve. So, thank you for your cooperation. So, I'm going to remove my gloves and perform a proper hand hygiene.